Hello everyone, we are from MBG Analytics. We are in a team of three consisting of me, Kenneth Owen, Crisanto Winata, and Wesley Pevendo. Okay, so first thing first, I'm gonna discuss about the background and the challenge statement. Stormont Vail Health, or SVH, is a regional health system based in Topeka, Kansas. They shared 4 years of patient data, which is from 2022 until 2025, covering around 947,000 patients with 7.6 million encounters. And the challenge statement that were given to us is to describe patient journeys to understand how the system can be adjusted to meet the patient needs. So first thing after we got the data set is we do some necessary EDA and we skip some unnecessary EDA that we won't be deep dive into it, which we consider this after we read the variable definition and dataset README statement. So basically, we primarily focuses on the type of diagnosis from encounter joined by the patient data. Okay, so after doing some EDA, we choose diabetes to be analyzed deeply, and this is our topics that we choose. And some of the reason we choose this topic is first, diabetes is a lifelong disease, so it tends to have predictable pattern. And second, diabetes has a global standard, which is from ADA or American Diabetes Association, which stated that patient must have 2 until 4 checkup a year. Third, in this dataset, diabetes has a large number of patients, and lastly, it has high impacts for both health and costs. Diabetes is expensive because it has many complications like kidney, heart, and eyes.
Okay, so SVH has more than 20,000 diabetes patients. They should see the doctor 2 to 4 times a year, but most of them do not. We put them into 4 groups. Well managed, they visit often, their diabetes is okay. Reactive, they only come when it gets bad. Usually the ER. Sparse, still here, but rarely visit. Lost, they have not come back for more than a year. So only 1 in 3 patients is okay. The other 13,000 have a problem. Many people think they all fail for the same reason. No money, no car, no time, but our data shows something different. Do they all have the same problem or do they have 2 different problems? Before we answer, let us show why it matters. Next. Letting diabetes get worse is very expensive. One ER visit costs up to $25,000. One checkup costs only $300. The difference is huge. And if diabetes is not treated, it gets worse. Kidney problem, nerve problem, blindness, all very hard to fix. So SVH has 2 choices: do nothing, and the same 13,000 patients keep going back to the ER again and again, or help just 1,000 patients first. Even a 20% success rate saves hundreds of ER visits every year. The question is not will SVH pay, it is when and how much. So, who are these 1,000 patients? Let us show you.
So basically, based on the EDA that we did, we managed to categorize 4 kinds of patients that are well managed, reactive, lost to follow up, and sparse. And based on the hardship domain that we analyzed, that hardship domain means the patients that have background troubles to attend to checkup or healthcare in general, that are transportation, food, financial, and etc. And based on that, we can see that the reactive sector have 3 times the baseline on the lost to follow-up, sparse, or well-managed category. While on the right data, we can see the correlation between lost to follow-up patients, the slip-away patients, the sparse and lost to follow-up patients, to the features that we can see, but apparently none of them are very high correlated with each other. Next. Further analysis upon missing patient, people that are in the slip away category, which are sparse and lost to follow up, have less crisis brown trouble as depicted in the charts. We can see that on the left side, we have more of slip away patients and mixed patients that are mostly on slip away zone, while the right one have more crises. So as based on this, we can see that per census block, sleep-away patients are a lot higher than patients that are in crises hotspot, that is reactive. Next. On the insight we have from this chart, the engaged patients, the well-managed, are 35% of the whole population of type 2 diabetes, while profile A had 2.7%. Profile A are mostly filled with reactive patients in any versions, and profile B is filled with drifted patients that didn't follow up to their appointment with their doctors about their diabetes. Next. So basically, that's it for our presentation. Thank you very much.